The Migrant Workers Committee and the Mental Health Campaign Committee on behalf of the Bermuda Public Services Union presents a virtual panel discussion called Shifting the Narrative, Demystifying Mental Health in the Workplace and Community. Let's end the stigma.
Good evening, everyone. I'm Brother Amel Thomas, President of the Bermuda Public Services Union. On behalf of the BPSU, I'm honored to welcome you to this vital virtual panel discussion in observance of World Mental Health Day 2024. The theme of this discussion, Shifting the Narrative, Demystifying Mental Health in the Workplace and Community, aligns directly with our mission to break the stigma surrounding mental health and ensure that every member of our union and the wider community of Bermuda has access to the critical support they need and deserve. This discussion reflects the BPSU's unwavering commitment promoting mental wellness, not only in the workplace, but throughout our entire community. We are privileged to collaborate with Bermuda's leading mental health professionals who will share their valuable expertise and insight as we tackle this pressing issue together. We hope you tune in and engage this important conversation.
Thank you for this esteemed panelist here today as we celebrate World Mental Health Day. I look forward to a riveting and insightful conversation on mental health as it relates to our people in Bermuda and for people who might be viewing throughout the world. And I want to thank you all for being here today. And so in the interest of time, I want to jump right into the conversation. And first up on my list, I would like to bring in Juanae. Juanae, I hope you are well, and I hope that this question is well for you as well. So thank you so much. I'm going to jump right in. Juanae, the Women Resource Center has been a steadfast ally for women in Bermuda over the 3 decades. That's a long time, right?
Yes.
Offering a range of services, including support groups, therapeutic counseling, and community education. The question for you is, how do these services create safe spaces for healing and empowerment, particularly Juanae, for women's mental health well-being when facing trauma, grief, and societal challenge? A mouthful. Take us through.
Yes, that is a mouthful. Well, I'll first start just by saying that as we raise awareness on the necessity of mental health care, we also have an obligation to raise access to healthcare services. So the Women's Resource Center, we're committed to creating those safe spaces because it complements the awareness work that we do. We don't want to be raising awareness without at the same time creating a safe space for women to be able to come and actually receive the service that they need. And so at the Women's Resource Center, our services are specifically for women who might not be able to access private mental health services. And so they are low cost. At some times they are offered at no cost, so that we're removing any of those social or economic barriers to mental health support. And so I feel like that's one of the biggest and major ways that the Women's Resource Center is contributing to creating safe spaces, because we're ensuring that every woman has access to a safe space.
No, you made that word you use a few times, access. And in the world of mental health, a lot of people talk about having mental health facilities and stuff, but access always seems to be the stumbling block. And I want you to tell me from the WRC perspective, how, in terms of advocating for systemic change, and I'm thinking that access is part of that systemic change, that you all produce there to promote gender equality and improve overall mental health well-being for women in Bermuda.
I'm sorry, could you just repeat that last part? I was trying to follow the whole way through, but...
No, what I'm really excited to learn from you, and what I would like for the viewing audience to learn, is how do you promote gender equality and improve mental health well-being among the women in Bermuda?
Okay, that's a great question. So when we think about mental health, obviously women, we experience the world differently. And so I
Mhm.
think in our desire to promote equality, we sometimes forget that our differences are actually important. And so, what the Women's Resource Center aims to do is make sure that our services are tailored specifically for women so that they have what they need.
Mhm.
And so, it's less about the service being equal, as in exactly the same as what should be provided to man, but it is offered at the same rate and in a way that best fits a woman's needs. So when we advocate for equality and equity, it's not just about having a level playing field, but it's also about making sure that women are getting the support that they need because we experience the world differently and we often need a different kind of support.
So I like that. Are there any specific initiatives or success stories that you want to share with the viewing public?
Sure. So one thing that we've done over the last 12 months is open up our resources for mild to moderate mental health support for women. And so what that allows is for, let's just say, a woman who might be experiencing menopause or postpartum depression. She has a space that is specific for her with a professional that is trained in those kinds of gender specific issues. Because as I mentioned, we experience the world differently from man. And so we need to make sure that our support services are sensitive to that. And so we actually had someone reach out to us saying that they specifically were going through menopause or the change of life, as we like to say, and she needed a safe place. She just was having a hard time. She had never experienced any mental health challenges before until that
Mhm.
time of her life. And so we stopped and we thought about it and we were like, okay, how can we create a safe space for women as they go through different transitions, such as menopause or postpartum depression or becoming a first time mom or divorce and all the different transitions that we go through as women. And so I think that's one of the big successes that have come out of the work that we've been doing over the last 12 months is tailoring our support specifically to what a woman would need.
I want to thank you so much because what you've shared there is so powerful. And I'm going to come back to you because, interestingly enough, like you, who advocating for women's right and mental health in that sphere, we also have Ernest on the panel who equally advocates for men. And so, Ernest, I want to bring you in immediately and ask you, MASC, and perhaps if that's an acronym, you could help us to understand what it means in the first instance, but you offer a variety of counseling services, resources specifically tailored for men, like your colleague there, in terms of women. How do these services, such as individual counseling, group therapy, support group, addresses the unique challenges that men face in our community? And a follow-up to that, what impact have you observed through these initiatives? Ernest, I'm not hearing.
MASC actually stands for, that's actually short for masculine, as opposed to an acronym. We were really busy trying to figure out exactly what to call the practice. But we simply wanted to provide a space where men can actually come and unmask, create space where men come and sort of take off that sort of bravado, sort of remove that sort of social masculine front that we often use and really have an opportunity to sit down and talk face to face with another counselor about what's really going on. So one of the things that we realized early on is that men, particularly in Bermuda, like in many other jurisdictions, there is this whole cultural stigma about seeking mental health services. And there is a small niche of the population that's always been looking for an opportunity that if I am going to get some help, I really would like an opportunity to talk to a male therapist. So we certainly wanted to sort of create an environment similar to what the Women's Resource Center is doing. Let's see if we can create a space that's genuinely male centric so that men who are looking for help and who wish to get help from a male counselor, there is a good place to get that from.
Just a question. Do you find a lot of men accessing the services freely?
So access came up in one of the previous conversations. That might be a theme that actually might sort of dominate the panel discussion tonight. Men do not participate in mental health services to the same degree that women do, at least from the research and the understanding that I have. When it comes to access, unfortunately, a lot of men actually don't have good insurance. And sometimes it's real difficult for men to find good mental health services privately. And perhaps maybe that might be one of the reasons why maybe the first contact a male may have, whether it be juvenile or adult, is either going to find mental health services through the public services or through the social services, or maybe even through the criminal justice system for the first time. But hopefully with conversations like this, we can begin to sort of improve those stats and opportunities so that there's early intervention, there is this reduction in stigma, there is access made available across the board so that individuals can get the help that they need.
Very interesting. And I like that, because what I want to learn from you, Ernest, is the initiative like the Manhood Project and 24/7 Dad. How do these programs empower men to take proactive, and you just mentioned that, to take proactive step towards their mental and physical well-being?
Yeah, we're really excited about those two programs that we've been able to bring online in the last 12 months. The Manhood Project actually is a collaboration between MASC and Big Brothers and Big Sisters. That's a program that's designed to sort of meet the social and life skill and emotional needs of adolescent boys. Particularly in this cohort, these may be boys who probably do not have significant male input in their life. There might be an absent father, there might be a father who's incarcerated, there might be a father who perhaps is deceased. And these individuals are probably young adolescents who, if without the Manhood Project, probably won't have pro-social, access to men and have an opportunity to really have a camaraderie with other boys in a similar sort of setting. With our 24/7 Dad program, that really is a program geared towards really, one, honing on the idea that father engagement is critical across all the developmental stages of a child's life. And we really want fathers to be fully engaged in the children that they have, whether they're married or whether in a co-parenting situation. Because we really believe that these fathers really need the life skills, the parenting skills, the communication skills necessary to really be the type of fathers and dads that they can be. And I think if we do that, we can certainly make a significant impact in our community.
Thank you for that. I mean, I'm just listening and I'm excited about that, because as you really say, we need to be proactive, especially with our boys transitioning into manhood, and to capture the challenges before they become challenges, especially in the criminal justice arena. So I'm very excited about that program, or those two programs as well. I want to move the conversation along to our dear friend Sandy. And Sandy, based on what I've known from you, is that you're a leader in the Family Center, which is really dedicated to improving the lives of families in Bermuda through innovative mental health services. How does your organization ensure that access to support is truly barrier-free for all families? Access and barrier-free.
Yes, absolutely. And thank you as well for having me here. And just when Dr. Peets talked about the access will be a big word tonight, Family Center was actually founded on needing to create access for people to actually receive mental health counseling support. So Family Center is a registered charity in Bermuda, which means that we actually fundraise for the costs of every single thing that we do, meaning that all of our programs and services are offered at no out-of-pocket charge to families that we service. And we service families with children from the ages of 4 to 18 years old. So our founder, Martha Dismont, back in 1990, recognized the need for children's parents to be able to refer their children for support without this barrier of cost. And that's how we got started 34 years ago.
So I'm really hearing barrier free. And by being barrier free, you actually create a scenario where families can actually come and get the services that they need. So, Sandy, in addition to that, the Family Center engages with the wider community to advocate for mental health awareness and promote well-being. Can you share any partnership outreach programs that have significantly contributed to creating a healthier environment for families in Bermuda?
We've actually developed a continuum of care over our 34 years of existence. So even though we started with counseling, what we actually recognized was that not every family is going to knock on that door for counseling due to other barriers, such as stigma, such as thinking, well, if I let out what is going on in my family, maybe other stuff is going to come out, and that can lead to shame or even fear of having one's children removed if people are just, honest about what is going on. So we recognize not everybody's going to knock on that counseling therapy door. And so the middle of our continuum was born, and that's our community outreach programs, which are actually held in the public schools in Bermuda. And so we have our Beyond Rugby program that is at Cedar Bridge and Berkeley High Schools. And then our Beyond Yoga program is in partnership with Delwood Middle School. So what this means is that in addition to voluntary signups from the young people, we also have the student services departments at the school just tap on some of the young people's sort of, shoulder to say, hey, I think you should really sign up for this program, so that if the young people and their families can engage with us in a program that is sort of more outreach, the more they get to know us, the more comfortable and safe they feel with us, then maybe they might be also more sort of it might ease their passage into counseling services if needed. Those 3 programs are always at full capacity, certainly every year, and have been very successful since 2009. And then on the other end of our continuum are our advocacy initiatives, where we do run public advocacy campaigns, in Bermuda in partnership with other organizations like SCARS Bermuda, like Center Against Abuse. We work with our colleagues who are here with us today as well, because we know that none of this work can be done in a silo. So we do many presentations and workshops across the island. We also work closely with Child and Adolescent Services, which is the psychiatric clinical unit of our Bermuda Hospitals Board for children and families on the island. So through all of that work is how we achieve our impact, and we know there's still much work to be done.
Dr. Sandy, thank you so much. But I want to throw in this one other question for you in terms of access, because I like how you spoke about the continuum of care, beginning, middle, and end, right? And I also like the bridge that you build between your organization and the community. And I'm wondering whether or not you have found this to be easy in Bermuda, where the community is willing to partner with you, whether through funding and or expertise, to ensure that the work continues.
Fundraising
I'm not hearing.
landscape. The fundraising landscape globally, of course, changes with different trends happening in the economy. But in Bermuda, we do have incredibly generous donors. And then working with partners is so easy when you just ask each other. So when you approach one another, we are so willing to work together. And that also includes the school system and all of the systems that impact the populations that we see.
That is awesome. Awesome job. Everybody here is just doing human services in relation to mental health, and I really appreciate that. And so with that, I want to bring in Rebecca from Mid-Atlantic Wellness Institute, or what we will call MWI. Thank you so much for being here. The sole psychiatric hospital in Bermuda. How does this hospital assist families dealing with tragedies and mental health issues within the community? Let's start with that question.
Thank you very much for having me and giving us the forum, actually, along with my colleagues on this panel, to talk about how we support each other in our community here in Bermuda. And so as the main hospital, actually representing mental health services in collaboration with our external partners working collaboratively and providing integrated services, we actually run family support groups across the ages. So be it families that are supporting young ones, families that are supporting the adults, and families that are supporting the older generations. And also, regardless of what the mental health challenge may be, we run family support groups to support those who are providing support for their loved ones. Because we all know, regardless of how resilient each one of us, we all need care and support. Mhm. And so
I love how you say that, support the supporter.
Yes. Yes, caring for the carers.
Yeah.
I love that. I like that one better. Let's call it that, caring for the carers. I like that one.
Because it is important to recognize that we don't want it to be a chore. We also recognize that when one member of the family, regardless of the age, is ill, we are all ill. It does impact each one of us, regardless of the role we play within the family, even if we are extended families, because we all worry for one another, and the support we provide for one another enables us to actually live fulfilling quality lives. And so we see providing family support as one of the essential care and treatment that we deliver.
I love that, because a lot of times the carers become so overwhelmed and burdened, they develop a diagnosis at some point, right? And I'm wondering though, Rebecca, what community-based strategies do you employ in addition to the group session, which is just amazing? What community-based strategies do you employ to support those affected by mental illness? And how these align with the recovery model outlined in the MWD Directorate Plan 21 to 26?
Actually, I think this panel reflects how we fulfill that. It's about collaborating with our community partners, because like Ms. Sandy has just emphasized, it is not about silo working. We cannot do it just by ourselves. It's by collaborating with each other, regardless of what the service is, to actually deliver the care and the support that our community needs. And so for us, we actually do refer some of those who are engaging with us to each of those represented in my panel right now. So we work very closely with SOCIS, with family support. We also work very closely with women's resources. And actually, we have found that the collaborative approach to care has actually enabled the access. It has actually helped in increasing and breaking down the barrier to accessing care. Knowing that our emphasis, and this is where the recovery model comes in, which emphasizes choice. It's not about me as a clinician dictating care. My role is actually to provide choice in treatments. These are what is available, and working together with the person to identify what would specifically meet the need of that individual. Recognizing that meeting that need may not sit with my organization. However, I represent one with the knowledge, the resources to signpost that person to the appropriate organization or partner in community that can meet that need. Or it may be one that collaborative working with the external partner may be one that actually meet the need of the person. And so in terms of the MWI Directorate Plan, which focuses on community presence. If we are more present, if we are more integrated with primary care, focusing a lot about health promotion, because there's a lot of information out there, but not necessarily the accurate information. And so the emphasis is not on illness, the emphasis is on health, be it mental health, physical health, emotional health, spiritual health. And so working collaboratively with all our partners, we emphasize that mental health is a continuum. And I believe that my esteemed colleague here spoke about that. Health is a continuum. You know, how I feel at the morning may not be how I feel this evening. Many
Or
things
even
may
lunchtime.
happen. Yes. And so that way, we are emphasizing that actually myself as the patient, myself as the one who actually has the need, I am the primary driver in my care. I may come to you for directions on how to get to where I need to be, but actually, I am a strong partner and my rights need to be recognized in making treatment decisions. I need to have a voice. My voice needs to be heard. That's our direction.
Wow.
That's how we use the recovery model, which says that despite my challenges, focus should be on my strengths. How can you promote
You know,
my strengths?
I listen to you, the passion, and I must say, if your clients are on the receiving end of this passion, we know that they're in the right place, right? And I'm really excited about that and your passion for treating. And with that, you will definitely be able to literally demystify mental health in the workplace and community, because that is what ultimately we want to do. People should be free to come and say, I am not well and I need help,
Yes.
without feeling stigmatized. And with that, I want to bring the curtain down on this segment with our dearest friend, Latisha. And Latisha, who represents EAP, or Employees Assistance Program, which is creating safe spaces for employees and promoting diversity within our community. Latisha, in what ways does EAP mission to empower individuals and foster an inclusive environment translate into tangible support for persons facing mental health challenges in the workplace?
So, one of the things that I always think about is we are all at any given day somewhere on that continuum.
Yeah.
And so, for many of us, when we think of mental health, we think of someone who is struggling. But the reality is, at different points in our life, we may just be going through transitions. A promotion can be a source of stress if we don't know how that's going to work out for us. Having a new marriage, a new child, having a new opportunity. And so a lot of times when we think about mental health, we think of it in a problem saturated kind of way. When something goes wrong, what do we do? Instead, at EAP, what we want to transition people to think about is when we are going through the ups and downs of life, we all are going to need different levels of support. So whether it's I'm coming in for counseling, whether it's something like a management consultation, I know for myself as a manager, I always laugh about the fact that policies are easy, people are not. And so, sometimes it's really helpful to have someone to say, hey, I'm having this issue with bullying on my team. Can I explore that with you? Or performance appraisals are coming up. I have someone who doesn't take feedback well. Can I run this by you? And so whether it's the counseling arm, whether it's the consultation arm, or my favorite arm, the training arm. I like to say sometimes, because people say EAP is for if you're someone who has an EAP and you can go get that benefit. What about the general public? But that's not true. During COVID, at the height of COVID, we realized so many people were struggling. So many people, we were home, we were on lockdown, we were with our families 24/7, raised all sorts of anxieties. And so one of the things we started as a program was our Wellness Wednesday webinars. And it just started off as a pilot. It was only supposed to be for 1 month. Well, 4 years later, we're still doing it. And for example, this year alone, we had 44 free classes on a range of topics, everything from mental health wellness to health insurance, to domestic violence, to adult survivors of childhood trauma. We want people to have the resource that they need. So every month we have at least 1 to 5 classes that are free. You can sign up. You can be anyone in Bermuda. You don't even have to be with one of us. And they've really caught on, just stats alone. This year, from January to June, we've had over 600 people attend our classes. And let me clarify that, 600 distinct people. And so that is actually roughly, we have about 900 people who have participated, but those are 600. I came just once. And so what I love about those stats says
Powerful.
at least one thing appealed to you, but actually maybe many things appeal to you. And so one of the ways we're impacting the community is sometimes people go, I don't know if I want counseling. Is something wrong with me? But we all could use some education. And so just like Sandy was saying, by opening up one door, people then can walk in through the whole house. And I find that some people who have started with our webinars all of a sudden go, I never thought about that. Yeah, you know what? I did have this in my childhood. I could use some support. Or actually, you know what? I am struggling right now with having someone in my family who's experiencing this. I could use some support. So my favorite quote always is, I was quoting myself though, is counseling is often for those in our life who won't go to counseling. And so whether you have someone in your family where you're like, they could use it, but they won't go, then go for yourself to navigate being with them.
Wow. And that is truly demystifying mental health in the workplace. And I wanted to close off this section with a powerful and compelling success story that illustrates the positive impact of this approach on clients' mental health and well-being. Latisha, one example from the work that you have done in EAP.
So my favorite story is actually tied to how I see mental health in general. So today, actually, I went and got my physical. There's nothing wrong with me, but as part of our understanding of health, on an annual basis, we're supposed to go and check in with our bodies and make sure everything is right. I have a client who's come to me probably 10-ish times over a 12-year period. And she thinks of this as her mental health check-in. And so she comes about once a year, sometimes for one session, sometimes for 4. If something's really troubling her, maybe 8, where she just wants to check in with how's my life doing. And so I think of this the same way we're really at the point where we understand that good physical health is proactive. Like, are we brushing our teeth? Are we doing our exercises? Are we eating properly? Good mental health shouldn't be when everything falls apart. It really should be proactive. So maybe some people that's talk therapy, some people that's affirmations, deep breathing exercises, journaling, but having a mental health plan. This is it. Having a plan means intentionality. It means taking it from a hope and an expectation to something that actually gets lived out. And so I think the biggest thing we do at EAP is give people a blueprint for their own life, but based on the individuality of them.
Wow. And so Latisha, Rebecca, Sandy, Ernest, and Juanae, I want to say this was a riveting conversation as we begin to demystify mental health in the workplace and community. I want to say thank you for your contribution. It was well placed. And if there's one thing that I've heard tonight is 5 passionate people about what they do, building bridges, breaking down silos so that people can have a better mental health experience in Bermuda. And for that, I thank you.
Thank you.
Thank you. Thank you for having me.
The Migrant Workers Committee and the Mental Health Campaign Committee on behalf of the Bermuda Public Services Union presents a virtual panel discussion called Shifting the Narrative, Demystifying Mental Health in the Workplace and Community. Let's end the stigma.
Shifting the narrative, demystifying mental health in the workplace and community. And what a fitting conversation we're going to have with one of the most powerful unions in relation to mental health. I think one of the unions that is doing human services in relation to mental health on the island of Bermuda, and a trendsetter throughout the Caribbean as well. And so I want to jump right into the conversation with Sister Karen. And I want to thank you so much for coming here today. And so as a representative of the BPSU Mental Health Campaign Committee, and perhaps you could tell people what BPSU stands for as well, how do you see the role of union in advocating for better mental health policies in the workplace? Let's start there.
Well, BPSU stands for the Bermuda Public Service Union. And unions play a vital and crucial role in advocating and promoting the mental health and well-being of employees. This can be done by us advocating for better working conditions, better working environment, raising awareness, because mental health literacy is so important for persons to understand mental health and to decrease stigma and discrimination. Also, unions play the role in being mediators, facilitating conversation between employees and management. So the role of union in promoting mental health and well-being of staff is very much crucial.
Wow. And so I want to further the conversation with what specific initiative can union implement to support their members' mental well-being and combat that word stigma within organizations?
Try to promote a culture of inclusivity. Ensuring also advocating via collective bargaining agreements for fair pay, for fair benefits for employees, because a lot of mental health stressors come from financial stress. So advocating for persons to have a livable wage is important. Also ensuring a culture that does not discriminate. We have a mental health plan in the workplace, and we have an action plan to identify and eliminate discrimination. So employees can feel safe in saying, I am having a mental health challenge, I am having an issue, because we are all on this continuum together. And an injury to one means an injury to all.
I love that community impact effect that you're speaking about there. So building on that, Sister Karen, how can unions collaborate with mental health professional and organization to create that exact thing that you are speaking about there, to provide comprehensive support systems throughout Bermuda for people in the workplace?
Culture of openness, wherein persons feel free to reach out for help. Also advocating for training of union reps to provide support to employees, training of managers and supervisors to recognize early warning signs, to provide support and to know where to refer their employees for counseling, might be to EAP for further assistance. Also, advocating for job demands to be realistic. Ensuring that employees have access to resources to do their job, to prevent burnout, moral injury. The union play such a huge role.
I agree with you, but Karen, recognizing the diverse workforce in Bermuda, how can unions, especially your union, and organization better support all workers, including those from different countries, to ensure their mental well-being is also of paramount?
Ensuring that there is inclusivity and fairness. Equal benefits, equal opportunities for promotion, ensuring equal opportunities for training, advocating for safe psychological space wherein employees can raise their hands and say, I do not agree with this, without fear of repercussion, without fear of managers saying, I am not going to renew your contract. Also, allowing taking a no-nonsense approach to harassment, bullying, incivility, and discrimination. There has to be equity in the workplace and inclusivity, ensuring that no matter which nation, which country, employees feel valued and appreciated.
Wow, that was very powerful opening, and I want to thank you for that, sister. And I want to pass the baton on to Labor Relation Organizer and Rapid Response Officer. And I like Rapid Response Officer, and that is none other than Sister Linda. And Sister Linda, I want to bring you in on the conversation as a Rapid Response Officer. I like that. It means that you're always ready to go. And mental health, when people are dealing with mental health challenges, they need immediacy, right? You don't want tomorrow or next week. So I know you jump in the car and you go. So how can unions play a proactive role in responding to mental health crises among their members?
Listen, Brother Hanif, if we're gonna start to have real conversations around the impact of mental health in the workplace, unions have to be at the forefront of that conversation. We can't be trying to catch up, right? And unfortunately, in the midst of us having this dialogue, COVID came along. And COVID had such an impact in the workplace that we were all left asking the questions of how do we move from here? And many work bargaining units didn't ask the question, how do we move from here? Their objective was, how do we return to what was? And that distinction in the narrative has proven to be detrimental to our membership, because to go back does not recognize the impact COVID had on our workers and the workspace. And so what we as a union have to do is we have to raise that conversation and say, hey, before we go forward, let's talk about the impact. Let's talk about the impact. Let's talk about what it means when you say to your employees, pick up and come back into the workspace. We haven't talked about what have you done to create a safer workplace. We haven't talked about what have you done to ensure that I have the mental capacity to come back to the workplace. All of these things are significant. And the person that tasked with having those conversations on behalf of the workers has to be the unions.
Sister Linda, I want to throw in something here for you. Do you believe unions fully understand mental health in the workplace? And equally important, do you think that employers understand the importance of and also believe in mental health in the workplace?
And I don't think that employers do. And you know why? Because
Could you
we
repeat me?
haven't turned. I said no. I don't think that unions do, and I don't think that employers do, because we haven't put in the work to have the training, the understanding in order to have those real conversations. And that's the reality. Now, what I do think that our union has done is acknowledge that we don't. And so we have begun the work to prepare ourselves through training, through our mental health campaign, so that our members know, and by extension, we've invited our bargaining unit to start on the path of getting training ourselves. Because remember, we all went through COVID together. And us in union leadership in the bargaining units, anybody asked us about our mental capacity? And this is where I say, Brother Hanif, we have to start having these real conversations. If we're genuinely going to move forward in a direction that is best for all of us. So we all have to put up our hand. When we were outside just now, I was having a conversation with our colleague, and I said, it's going to also take us to do some work around self-reflection and really how we as individuals view mental health. Firstly, before we even start to have those conversations in the workplace. But we can do them simultaneously, but we have to take ownership that we may not have the full understanding as well.
I want to thank you for your honesty there, because I think that honesty leads into a place of knowing what we know and knowing what we don't know and knowing what we need to know. And I appreciate that. Just quickly before I move on to our other panelists, what barriers do workers face when seeking mental health support through unions that you have recognized in your work as rapid response officer thus far?
Well, one of the barriers, and it pains me to say this, but even though I'm the rapid response officer, I may go in quickly, but the outcome doesn't happen quickly. The outcome takes time, right? And in that time,
it could be detrimental to the member. And so that's a barrier that's faced. That's a barrier that we are trying to work on through our collective bargaining agreements and our understanding. Another barrier is just the stigma to say, listen, I'm not okay. And when I'm not okay, I cannot function 100%. This mentality about leave all your issues and your challenges at the door when you come to work, we can't go on like that anymore. We carry all our baggage with us. But yet we are expected to operate at optimal. And that is not realistic. So that is a barrier that's faced, and that is a barrier that the union has to talk about of how we use our tool of our collective bargaining agreement to assist the members in that regard.
Thank you for that. Very powerful, very down to it, and very open. I love it. Thank you so far. I want to bring in Dr. Adrian in the conversation, and as a mental health professional, what do you believe Bermuda government can do to enhance access to mental health resources for the community? Let's start with access.
Gosh, that's such a huge question because there's so many things we can do. But truthfully, as one of the starts, I think we need to stop looking at mental health as this special one-time thing or this one-time isolated phenomenon. It's not that. If you have a brain, which everyone does, you experience mental health. So you may not have experienced mental ill health symptoms, but we all experience mental health. And I find that although we've gotten so much better, and thankfully COVID has changed that for us, we still treat it as a phenomenon that only some of us experience. And so I think we really need to have honest and upfront conversations about everyone experiences mental health difficulties. And like the panel had said earlier, we're on a spectrum. We kind of float about on what optimal well-being is and mental distress is. But we need to have frank conversations that are not positioned that mental health is only for certain people. It's only those who have psychosis or depression or anxiety. We need to be honest that every single one of us goes through something. Every single one of us has stressors, whether good or bad. And we need to create initiatives where they are weaved into everything that we do, not just, oh, let's talk about mental health when something significant has happened, which is what we tend to do here, unfortunately, and everywhere.
Wow. You're so on point here, Dr. A, because but I'm wondering if policy changes, in your estimation, can address some of these stigma in a significant way.
Absolutely. So again, if and my colleague will be able to talk more about workplace, but if we have incentive programs by the government where it's mandated policies for, let's say, mental health days, similar to sick days, where you're not asked about what your sickness is or anything like that, because being frank, if you have a doctor's appointment, I don't think my boss would ever ask me what the gynecologist is at, what's going on. So I think that's a start. I think a huge thing that government can do in terms of policies is insurance. Government is the largest employer, and I'll be very honest with you, has the crappiest insurance. The coverage is subpar. And another thing in line with that is that the insurance companies dictate a lot of what professionals and care workers can do. And it's quite frustrating when an insurance company can tell a practitioner that in order to help someone achieve their optimal well-being or optimal brain health, that you only have 3 sessions, and if finances is such a huge stressor that we're only going to cover maybe not even a quarter of that, and that's all you get. And we have no leverage in being able to say, hey, our patient really needs the care. This is what it's going to look like. And we don't get to have those conversations. So if government is able to step in and put in policies and legislations in place where we have a voice as the providers to make Bermuda well, then that's a great start.
Yes.
And it needs to happen.
Dr.
I think we need to have those conversations.
Do you think, another curveball here, do you think that understanding the dark figure of mental health is going to be important in this conversation, because we know annually there's over $400 billion spent on what we call the hidden cost of mental health. Because when people take sick leave, do I really have the common cold or the flu? Or do I just really don't want to put on a paper that I have depression and I really can't get out of the bed and have a shower this morning? Do you think it is time for us to examine the dark figure in order for us to really understand the policy change? Because one way or the other, doctor, you don't pay upfront by giving subpar, but then the person becomes overall ill, physical and emotional, spiritual, and everything. And somebody pays for that on the other end, right? What are your thoughts on that, Dr. A?
If I'm understanding your question correctly, the World Health Organization has already let us know that mental health and neurological health is the leading cause of disability worldwide. So we already
Correct.
know that we are at this position. It's just that we treat mental health as a scary thing that's not to be talked about. When we look at chronic pain, when we look at diabetes, when we look at cancer, we stand proud. We can talk about it till we're blue in the face in Bermuda, and we do. We have a day, we have tag days multiple times a year. There are walks. We do so much, and yet that is not to say we don't do that for mental health, but it's quite limited. It's not the same. And when you look at these diagnoses, if you look at other countries, mental health goes hand in hand. If you have diabetes, you're supposed to have a cognitive test for your screening. If you have chronic pain, you're supposed to be getting pain management through psychological therapy. So the facts and figures are already there. We need to act and actually implement. And again, it kind of goes back to in Bermuda, what kind of typically happens is that there is a huge event, is a catastrophe. We talk about mental health this, mental health this. It's super important. We need to do something, and then we go silent. And then something huge happens again. We're like, oh, mental health, that's be great, and then we're silent again. So sort of drawing back to it needs to be weaved in everyday conversations, everyday policies, and that does start with government talking to maybe some of the professionals in the field who are seeing this daily, not to say that they don't, but really getting some insight into how we can get it to the schools. And sort of like physical education and sex education, there should be mental health education. Getting into organizations, getting funding from some of these large businesses that we have on island who could be really great supporters and donors, working with individual practitioners to really get some of these balls going. We have so many great ideas, but we need the support. A lot of us cannot do this on our own, and it's not working on our own.
You've just raised so many questions that we can go on and on. But I don't want Dr. Juanae to feel left out there. So I want to bring her in where you left off, because you started to talk about training and development. And I wanted to ask Dr. J, as an expert in wellness, which is also on the continuum of good mental health to ill health, what recommendation would you give to the government for expanding, well, let's say starting and expanding mental health education training programs to support psychological health and safety in the workplace?
Absolutely. I'm going to follow on to what has been said. I think it's important that we start to move from a place of campaign to culture. We actually need to start to make organizational, cultural changes. And one of the ways that we can do that is with psychological health and safety in the workplace. Again, a follow-up to having organizations where you can admit that you made a mistake, be able to get help. These things aren't being held against you. We need to create environments where we can flourish with our good mental health, right? And so I think that this requires another level of understanding. It actually has to be fully implemented into the way that the organization is operating. It needs real guidance. We can't continue to send people to trainings and have them come back. It's one of the most problematic things that I believe is happening because you start to feel more isolated. You did this great training and no one else can do it, and there's no one to follow through, and the manager isn't doing it, and the leader isn't doing it. So we have to start to say this, we have to use our money different, right? I'm not saying the training is a problem, but how are you measuring this? We need metrics. We need metrics that are in place to say that these trainings are actually making the difference that they need to make. Oftentimes we say, well, we've always done it this way. Get on with work and this is how it is. Unfortunately, we have no metrics to prove that. And so when you think about communication, communication is something that can be measured. So we have to say, how is this effective if we're in a meeting for 3 hours and we get absolutely nothing done? Well, we always did it this way, but did we leave money on the table? Was this good for people's well-being? How effective was it? So we have to start thinking about what are the key performance indicators that are in place that measure communication. We have 4 generations currently, 5 generations in the workplace. The way that a baby boomer communicates and the way that a millennial communicates is not the same. But there's a reason this has to be a discord. We have to say, what is the noise that is in place so we can get to the core of the real issue at hand so we can start having better understanding across the generations. They don't have to be gatekeepers. We can just say there's an openness here. This generation understands where we are here. This generation understands this. Let's make it psychologically healthy and safe and not deter people from being open and being their best self. You're right. We cannot leave ourselves at home anymore when we come into the door. And people often push back on me when it comes to this. I said, welcome to 2024, where actually we have learned that this doesn't work. People want 2 things. They want to be heard and they want to be valued. And if you can get organizations, leaders, teams to understand how to implement, if you're a good person, you'll do it naturally, but some of us need training, which is fine. If we can do that, we are going to have an amazing shift within our largest employer here on the island.
Wow. And I like the blend of the panelists tonight because it really gives union who have a huge responsibility because of the membership that they carry and you guys who also interact. And so I'm hearing a lot of things coming out. And Doctor, I want you to consider with the evolving landscape of mental health, what initiative, innovative approach do you believe could introduce within organizations to promote wellness, psychological safety in the workplace? Talk to our union colleagues there.
All right, here we go. A few things come to my mind. So once upon a time, we didn't have things like an HR department. We didn't have things like a marketing department, right? I think it's time for us to start to shift the roles that exist within our organization. We have to reevaluate these things. They don't look the same anymore. We may need a psychological health and safety specialist that is a part of the team. They do not have to know all the ins and outs of this particular organization. They are responsible for guiding the direction of how this team operates. Shift the funds around. Some roles aren't really relevant anymore, which is fine because we will continue to evolve. So we have to start to redefine roles. And if we don't have a psychological health and safety specialist that is measuring the key performance indicators, that is helping the team to develop on a regular basis. Remember, I said we're no longer doing campaigns, we're doing culture. Change the culture. Because it's okay to keep sending managers to training, but if they haven't had extensive training in the art of things like communication, mental health, helping teams to develop, we can write a new job description for that type of role. And they don't have to be assigned to just one team or organization. They can work throughout different areas, but you can't burn us out. And I'm hoping we talk about burnout before the night's out. You have to be able to say, this is the role, and we measure it. Pardon?
Yeah, talk about it.
We're going to talk about burnout. We'll get there. Okay, I'll get there. I'm going to let my colleague help me out with that one too. We need to measure it. You go through this extensive training, but it needs to be measured. We need to know what is working and what is not working. Looking at sick leave, looking at productivity, making these changes people want to, we could have a place where people want to come to work. No, they don't have to be best friends. But if I go back to being heard and being valued, you don't have to agree. Just because someone is heard, it's okay for us to have a difference of opinion. But you genuinely heard what I was saying. And I'm not talking about I went to active listening training and I did active listening. No, what is this person saying? Have we reduced the noise to get to the core issue that's happening? Because they'll go back to the desk and sit there and scroll all day. And now we've now labeled them as toxic and they're a problem. And they've been trying to be heard for so long. But actually, it's because the person that was on the receiving end, all relationships, we have a sender and receiver, didn't have the ability to hear and nurture this person.
Yes.
Wow.
Agriculture.
Wow. Wow. Listen, please tell me.
You know, it's interesting because we talk about this mindset shift, right? And if we want to really shift cultures in the workplace, then we have to ask the question, what is driving the vision of these organizations, right? Because if your vision is driven by success, one, because we know there's got to be some pocket in there for success that's based on financial. But how do you get to success with unhealthy people, right? And two, if we shift our minds to healthiness and productivity leading towards success, as opposed to visions that focus on putting out fires. If you have workplaces that just focus on putting out fires, this is happening, we got to do that, then we end up where we are now. And who changes that? The people that change that are people that are hired, that are visionaries. That's how you begin to really change these mindsets, are the people that you're hiring and bringing into your workplaces. If you want to stay the same, then you continue to hire the same type of people. If you want to change, then you change those hiring practices and bring in different people, but also create different jobs that do different things.
But often underestimate the power of culture, because any day culture will eat strategy for breakfast. Oftentimes we are focusing on strategy, not culture, and any day culture will eat strategy for breakfast. Do you have a culture of transparency and integrity in this organization?
Absolutely.
And oftentimes we struggle in managing change.
Yeah.
And it matters not which change management model we use. If you do not have a culture of transparency and integrity, you will not be successful.
Absolutely. And when we think about culture, that's the people, the processes, and technology all coming together. And if you're not stopping to actually evaluate all of this coming together, then what are we doing? I agree. Strategy isn't the answer. Like I said, campaign isn't the answer. Culture is the answer for the true change. And I would co-sign on the hiring practices that we do have in place. So let's talk about it. You need diversity. And unfortunately, our limited understanding of diversity only goes to this point. We can sit at this table and the range of diversity we have at this table is levels to this if we were to get to it. But we have to have an environment where people can really speak up about those differences. And people have to understand conflict can be a win.
Of course.
We're being taught that it's a negative and we can't handle it. Conflict creates opportunity for further conversation to go to another level. When the mission, the vision, so we need to know where the vision is that we're all trying to get to, even if we don't see it the same way, we're more likely to be innovative, productive, to create forward-thinking opportunities as we go on.
Yeah, because people are not robots. They're not programmed to agree with everything you say.
Absolutely. And this type of thinking will give us a great space for people to flourish and have healthier, good spaces, good mental health in the workplace. Yeah.
And so I wanna champion BPSU as the leader to definitely we need to continue this conversation on a deeper level, especially, and I will adopt, Doctor, what you said, Jana, moving from campaign to culture because I really dislike with the greatest passion being called for World Suicide Day and World Mental Health Day and World. I don't like to go to these things only because these things are live. It is living. And we don't die and wake up on World Mental Health Day. We live through pain every single day. And it has to be the way in which we talk, we move. And so, Sister Karen, Sister Linda, Dr. Adrian, Dr. Jana, what I heard coming out is vision. I heard culture, I heard policy, and I heard evaluate. 4 powerful words from 4 powerful women. And I want to thank you for being part of this very dynamic conversation. I wish we had more time, but we must call it a night. So I want to say thank you, but I want to commend BPSU and the mental health team for this beautiful 2 sessions we've had here this evening. And I look forward to joining you in person or online for continued work in the space of mental health and wellness. I want to say thank you, and may God continue to bless each and every one. Have a good one.
Thank you.
As we bring this discussion to a close, I would like to express my sincere thanks to our esteemed panelists and our dedicated moderator, Brother Hanif Benjamin, for facilitating such a powerful and enlightening conversation. Mental health is not just a personal matter. It is the foundation of a healthy workforce and a community. As a union, we are committed to advocating for policies and initiatives that provide every worker with the support they need to maintain their mental well-being. I encourage all of our members and the Bermuda community to take this opportunity to listen, reflect, and act. Together, we shift the narrative. We can create a culture that prioritizes mental health, not just on World Mental Health Day, but every single day. A special thank you to the BPSU Migrant Workers and Mental Health Committees for their vision in bringing this initiative to life.